So this meta-analysis, we should not be in a hurry to extract the data for meta-analysis and do the meta-analysis. We never start with the meta-analysis. Compulsorily, we have to do it very systematically in the stepwise fashion. So you begin with your research question, problem formulation, searching the literature, screening all the studies which you have got through your search, doing the data extraction properly, doing a risk of bias. All this is tedious, it's hard work, but it has to be done in a stepwise fashion. And when you have then extracted all the data, coded it properly, cleaned your data set, it is then that, and you have decided that, okay, this much data is sufficient to go ahead with a meta-analysis, then you go ahead and do a proper meta-analysis. So this is something which is of prime importance. I'm just checking. Yeah. So what is a meta-analysis? As some of you all mentioned, meta-analysis is a statistical combination of results from two or more separate studies. And you want to summarize the data in a quantitative fashion. So you want to get a pooled estimate from multiple numbers. You want to come up with a single number which correctly represents all of those studies. And you want to do all of this using the statistical principles. That is what you should remember. Now, what are the benefits of pooling the estimate and getting a pooled estimate? You are able to summarize the overall effect size. Instead of having multiple effect estimates, you get one single number, and that is the power of the pooled estimate. Another important thing in a meta-analysis, when you are doing a meta-analysis, one of the results which comes out is the heterogeneity. That is, you can also comment on the variability of the effects between the studies using the techniques of meta-analysis. And then if there is heterogeneity, meta-analysis can also help you explain the heterogeneity and identify factors which contribute to the variation or to the heterogeneity. So usually we focus our attention on the pooled estimate, but there are other collateral benefits which you can, try out with meta-analysis. But when you want to pool the data across multiple studies, the key challenge is the heterogeneity or the variability of the study, because among the studies, because each study is going to, the effect or the estimate reported in each study is going to be different from each other. So you have to choose appropriate statistical models based on this heterogeneity. So can you tell me some, are you aware of any models for doing meta-analysis?
You're talking about the fixed effect model and random effect model.
Correct. Yes. So you have to decide which model you want to use for pooling the estimates, and that depends upon the variability among the studies. So you can see here that there are 3 studies and they are showing you different estimates. So these estimates are different from each other. 2 of the estimates do not cover the null value of 1. This is a risk ratio, so the null value is 1, and 1 covers the null value, and they are all different from each other. And in the meta-analysis, you want to pool all of these results and get this diamond-shaped pooled estimate. So this is meta-analysis, that you want to combine the results across these 3 studies. But these 3 studies are reporting estimates which are different from each other. One is 0.49, one is 0.96, one is 0.73. So how do you pool these results and get this pooled estimate, right? So there are different models, 2 models which are distinct from each other, as Siva mentioned, the fixed effect model and the random effects model. You have to decide which model you want to use. So how do you make that decision? For that, you have to understand the heterogeneity. That is the variation among the studies, the variation in the effect of the intervention which has been reported among the studies. If variation is high, you use the random effects model. If the variation is low, you can afford to use a fixed effect model. So that decision depends upon the heterogeneity. First, let us see what is heterogeneity. Heterogeneity means there is variability or there are differences in the effect estimates reported by different studies. The question is, why do these effects vary from each other? So there are different types of heterogeneity. One is clinical heterogeneity. That is the studies have been done in different participants. One study has been, for example, done in the elderly, one has been done in the adults, one has been done in the youth. So if the participants are different, some study has been done only in pregnant women, then of course your effect estimates are going to be different. The interventions per se could be of the same category but could be different from each other. For example, you want to improve the compliance of the vaccination schedule in your ARV OPD. So the intervention could be sending SMS messages or follow-up calls, but they are very different from each other. Even if you say there is a common terminology of digital tools to improve compliance, but they are different from each other, which will result in variation in the intervention effects. Sometimes the outcome measured could be different, or different tools may be used, or scales may be used for measuring the outcomes. So there will be differences in the effect estimate. Another reason for heterogeneity is that there are methodological differences. There could be differences in study design. So it could be a RCT, or in some cases it is a before after study. In some cases it's a cohort study, somewhere it's a cross sectional or a case control study. Measurement tools are different. There is the difference in the quality of study and the risk of bias. All this contributes to methodological differences. And both of these can also result in statistical heterogeneity. That is, there are differences in the study results which are beyond sampling error. So whatever differences are there, some of those differences you will say are by chance, because when you take a sample from a population, you all know that the summary estimate of the sample will not always be the same as the population parameter, and the summary estimate of each sample will be different from each other. The same thing can happen here, but here we are saying that whatever differences are there, they are not just randomly occurring differences or differences occurring by chance. They are real differences, and usually these are because of clinical and methodological differences. So when you say in general heterogeneity, you are talking about statistical heterogeneity, which encompasses clinical and methodological heterogeneity. Are you all with me here?
Yes, ma'am.
Yes, ma'am.
This is an important concept.
Yes, ma'am.
Okay, thank you. So first thing is to understand that you are studying multiple studies, many studies. You are looking at the effect estimate reported estimates reported by multiple studies, and it is very likely that they are going to be different from each other. And we are looking at what could be the reasons that they are different from each other. Now, the next thing with heterogeneity is how do you identify and measure heterogeneity? So one is just visual inspection. So when you have your forest plot, each horizontal line in the forest plot represents one individual study. You have to, you know that in this forest plot, for example, the previous one we saw, these square boxes, they are the estimates reported in each individual study, and the horizontal line is the 95% confidence interval of those estimates in that individual study. So if you want to comment on the heterogeneity, one of the things you can do is just by eyeballing or by visual inspection, that is looking at these horizontal lines and looking at the 95% confidence interval and seeing whether they overlap with each other. If they do not overlap with each other, it indicates that there is heterogeneity. If they are all overlapping with each other, it means there is less heterogeneity. So in this example, you can see that the 95% confidence intervals are overlapping with each other. So that gives you some judgment about that there is no extreme heterogeneity between these study effect estimates. So one point to do is to look at the horizontal lines in the forest plot, and you can think of the approximate amount of heterogeneity which is there between the studies. Then there are statistical techniques which help you to comment on heterogeneity. One is the Cochrane's Q test. So you get the Q statistic in when you do your meta-analysis, which helps you to assess whether whatever differences are there between the studies are due to chance or are they beyond chance. So this test is very, very sensitive to sample size. So if you have few studies, this study has a low power to detect any differences which are beyond chance. And low power meaning to say that the sample size and the number of studies which are there, which have a say regarding the results which you get with regards to the Q test. And if you have high power means a large sample size, then even if the differences are not clinically important, they will be reported as statistically heterogeneous. So you have to be a bit careful with the Q statistic. And in some studies, in the methodology part, they will write that they have considered the Cochrane's Q test p-value of less than 0.10. So it is 0. So the point is missing here, 0.10 to indicate evidence of heterogeneity. Just because this is very, very sensitive to sample size, you can change the cutoff value for the p-value. But it has its limitations that, and you have to remember, and this Q statistics follows a chi-square distribution. So usually in your meta-analysis, in the forest plot, you will find a mention of chi-square, which is nothing but the Q statistic, which is telling us something about the heterogeneity. So can anyone see anything here in this, the results which I have highlighted here? And can you comment about the statistic which we just now discussed? You can see it here.
4.87.
Yes,
chi-square.
correct. So the Q statistic is equal to chi-square, which is 4.87. The degrees of freedom is usually the number of studies minus 1. So there are 3 studies, so the degree of freedom is 2, and you get a p-value, right? So you have to interpret this p-value. How would you interpret it? The null usually is that there are no significant differences between the effect estimate between the studies. So how would you interpret it? Just looking at the p, forget this part, p-value. Do you accept or not accept? Do you not reject or reject the null hypothesis when the p is 0.09?
Accept.
So you do not reject the null hypothesis, right? So somewhere your Q statistic and Q test is saying that there may be not substantial heterogeneity between these 3 studies. And then we also saw that the 95% confidence intervals were overlapping with each other. So that is one thing which you have to consider. Another statistic is the Higgins I. Now this identifies the degree of heterogeneity. In how does it do it? It is merely a percentage of the variability in the effect estimates due to true heterogeneity. So in the background, what I-square is doing, it is dividing the true effect variance divided by the observed effect variance, which is equal to the true effect variance plus the variance due to chance. So it's a percentage, you multiply it by 100. So just the percentage of true heterogeneity is what I-square is telling us. Now again, there are no hard and fast rules for I-square statistic, but there are rough thresholds. This is also very, very subjective. There are rough thresholds which help you to decide whether the heterogeneity is a mild, moderate, it is negligible, it is substantial, or it is considerable, right? So depending upon the proportion of the true variance, you can again make a rough judgment about the magnitude of the heterogeneity in the study. So again, usually the guidance is that you do not rely only on any one method of judging the heterogeneity. Look at all of these 3 and then comment on the heterogeneity in the study. Just remember that I-square is not absolute magnitude of heterogeneity. It is a relative magnitude. It's just a proportion of the true effect divided by the total effect variance. Are you all getting me till here?
Yes, ma'am.
You have to now comment on the I-square for this meta-analysis. What is your comment about I-square?
Substantial heterogeneity.
Yes. So if you use some cutoff, remember that in your methodology, you have to mention what are the cutoffs you are using to decide upon the heterogeneity. You can say all the three you have used. And then for I-square, what are the cutoffs you have used to categorize them in different grades of heterogeneity and accordingly write your results. So if you say that you are going to say 50 to 90% is substantial heterogeneity, then, and you can already see that there is an overlap here. So it is very, very subjective. If you are using any other cutoff, you can use that reference and say that I'm using the reference mentioned here. These are the cutoffs I'm going to use to categorize my heterogeneity. So you can see the Q statistic says that there is no significant heterogeneity. There is overlap between the 95% confidence interval, which also indicates that there is no significant heterogeneity. But your I-square statistic with the cutoff, which we decide, supposing as per the previous slide, we will say there is substantial heterogeneity. So you have to, before going in for pooling of the estimates, you have to first study the heterogeneity in between the studies which you have included in your meta-analysis. Are you clear till here?
Yes, ma'am.
Ma'am.
Yes, please. Anyone had any query? So now we come to, I told you there are two models and you have to decide which model to use. So first model is the fixed effect model or the common effect model. So the assumption for using this fixed effect model is that, please pay attention to these two slides. These are very important. You need to understand what is the difference between the two models and which one is appropriate in which scenario. Because you make two different kinds of assumptions for these two models. For the fixed effect model, the assumption you make is that there is only one true effect size, which is shared by all studies. But you see differences. So these observed differences are purely due to chance. They are due to sampling error. So if the heterogeneity is low or negligible, only then can you make this assumption that there is only one true effect. All of these studies are actually measuring that true effect, and whatever differences we are seeing are not true differences, they are only because of chance. If you are able to make this assumption based on your assessment of heterogeneity, then you use a fixed effect model. Are you with me here?
Yes, ma'am.
Now, there are different methods of doing a meta-analysis, that is of pooling the data. The most common method is the inverse variance method. And if you are using a fixed effect model, then the studies with larger sample size and smaller variance are given more weights. And what you do is you just take the weighted average of different studies and you pool the effect estimate to get your pooled effect estimate. And how do you pool it? By just weighing each study, and the weight assigned to each study is usually the inverse of the variance, which is directly proportional to the variance of that study and is inversely proportional to the sample size of the study. So you want to pool the data. How do you pool the data? By weighing the studies. How do you assign weights to the studies? By using this inverse variance method. And because variance, you all know, is inversely proportional to the sample size, invariably the studies with larger sample size are given more weight in the fixed effect method. Are you with me here?
Yes, ma'am.
Yes, ma'am.
Now, when do you use a fixed effect model? So when the studies are highly similar to each other and you have negligible heterogeneity, means the studies are conducted in similar kinds of population, the inclusion exclusion criteria are similar, interventions are the same, outcomes are measured in a similar fashion, everything is the same. So in public health, you will see that studies which are done in public health, they are usually never done in the same population. There are variations in interventions, outcomes are measured differently. So it is very rare to see fixed effect model in research questions relevant to public health. But a peculiar scenario where fixed effect model can be used is the pharmaceutical research, which are done in tightly controlled situations. So all studies which are done in a very similar fashion, all criteria are the same, intervention is the same. There, if you assess for heterogeneity, you will get negligible heterogeneity, and they can afford then to do a meta-analysis using fixed effect model. The take-home message is that for us in public health, we should be ready to do most commonly, most generally, use random effects model. One important limitation of the fixed effect model is its generalizability. That is, because you are saying that everything is similar, all these studies are similar to each other, whatever your pooled estimate and other results are, they are applicable only to the studies which are included in the meta-analysis, or studies which are very similar to the kind of the studies which you have included. So there is limited generalizability for the output from a fixed effect model. Are you with me till here?
Yes, ma'am.
The next type of model is the random effects model. Now here the assumptions you make are different. Here you say that the effect size which is reported from each study is essentially different from each other. They vary from each other. And however, there is a distribution of true effects. So usually the assumption is that they follow a normal distribution, all these different effect sizes around a true effect size. You say that they are not same, they are different from each other, but they follow a distribution. And what you are attempting to do with a random effects model is to estimate the mean of this distribution, the center of this distribution. Are you understanding how this assumption is different from the previous assumption?
Ma'am, can you please repeat once?
Yeah. See, in the previous model, fixed effect model, we said that there is only one true effect size, and all the studies are measuring that true effect size, but whatever difference I am seeing is because of chance. Here I am saying that each study is measuring a different effect size. These differences which I am seeing between the studies are not merely because of chance, they are truly different from each other. But I am assuming that all these different effect sizes are following a distribution. And I want to find out the average estimate of these distributions. If you are finding it difficult, I have 2 more slides where it will become more clear. Just hold on. So if you say that I'm making these assumptions, it means you are going to do a random effects model. Here, the weights which you assign. So again, inverse variance method can be used in random effects model also, but the weights which you assign to each study will be a bit different, because they have to account for both within study and between study variance. What does this mean? Each study, there will be they will report the mean value as well as the standard deviation for each study, or the standard error for each study. So the values of each individual in each study is going to be different from each individual in that study, as well as the midpoint value, that is the within study variance. And between study also, the summary estimates are going to be different from each other. So there is going to be between study variance. So in fixed effect model, we were worried only about one variance, right? That was within study variance. Now in random effects model, there are 2 variances which we are interested in. One is within study for each study, and the other is between study variance. And because of this, if you look at the weights which are assigned to a study, to the different studies, they are different. If you take the same set of studies and you do a fixed effect model, and then you do a random effects model, and you look at the weights which have been assigned to each study, they will be different. So they will be more similar to each other in the random effects model. Here, the smaller studies are given relatively more weights as compared to a fixed effect model. So what you have to remember is that the weights which are given in the random effects model to each study are different, and therefore your summary estimate will be different in a random effects model. So when do you use a random effects model? When you see substantial or very high degree of heterogeneity, and you can see that there is clinical diversity or differences and methodological differences in the studies as you are reading. So you know that, okay, all these are different from each other. So the effect sizes reported are different from each other. So let me use a random effects model. The advantage of REM is that the results can be generalized to other types of studies, because now there are different kinds of studies which have been included. It is more, the results are more easily generalizable to a variety of studies on the given topic. Are you with me till now?
Yes, ma'am.
So I'll give two examples to further clarify these concepts. So again, this is one example which will help us understand the fixed effects model. Now, what is the thing which is shown in these two diagrams? So here they are saying that if there is one institute and you want to find out, right, say the mean value of any construct for all the people who are enrolled in the institute. So one thing you can do is you can take a representative sample of people. So supposing here they have taken a sample of 1,600 individuals from the institute. Now when they are measuring the outcome, they cannot do it in one go for all the 1,600 individuals. So they call them in batches. So first batch is of 200, another of 200, 800, 200, 200, and they make the measurement for all the 1,600. Now remember, the premise here is that it's one institute and all the individuals in that institute will have one summary value, one true summary value. You have taken a representative sample of sufficient sample size and you are making measurements, and you are confident that the summary value is going to be the same as that for the population of interest. But now you have these sub-studies of A, B, C, D, E, which are, again, representative of the study population, right? So you can see that the 95% confidence intervals are all overlapping. The assumption which we made for the fixed effect model holds true here. That is, there is only one true effect. So the diagram on the right is showing that there is only one true effect. The first study, which has only 200 individuals, here you can see that it has very large variance because it has a small sample size. And you can see that the third study, which is of 800 individuals, because it has a large sample size, has low variance. But our assumption is that these squares, they are the summary values for each study. So the first study is 99.1. So each study has its own variance and its summary value. You are going to use inverse variance technique where the studies give weights. So you can see these are the relative weights which are given to each study. So based on the sample size, you can see maximum weight is given to the study with the maximum sample size. But the assumption is that all the studies are measuring this one true effect. And then whatever these differences which you see here, the mean values, they are only because of chance. So I'm assigning weights to each of these values and I'm calculating my pooled estimate. Are you with me here?
Yes, ma'am.
Yes,
So for those who are finding it difficult, I have mentioned the study. You can read this study in detail because this is a basic introduction to both these models, and they help you to understand how these two models are different from each other. The other model is a random effects model. Now here, the scenario is that you are doing the aptitude score for multiple colleges. So these are different colleges, and you have done an assessment of the students in each college, and you are saying that each of these values are different from each other. They are not one true effect. So you have this is the mean of this is the true value for this study, this is the true value for this study, but they are all different from some other true value. So this is what is the overall distribution of all the colleges. Each college has a true value which are truly different from each other, but all these true values are following a particular distribution. And what I want to do by using this model is to find out the middle value of this overall distribution. This is the random effects model. Are you understanding me here?
Ma'am,
Yes.
ma'am, but if we see the forest plot, on looking at the forest plot, confidence intervals are overlapping.
Yes. So, see, you will have to look at the forest plot, you will have to look at the Q statistic, you will have to look at I square, and you will have to decide. So, this is just an example to understand. You cannot rely only on eyeballing, nor can you rely only on the Q statistic. You will have to look at all the three and make an overall assessment of the degree of heterogeneity. These two are, of course, just an example to understand what is the underlying concept of both these models. So if I am saying that it is random effects model, I am necessarily saying that these are different from each other, but they follow a normal distribution. If you feel after studying all other parameters that these are not different from each other, then you will say all of these, they measure the same thing, and you will use the assumption of fixed effect model and move ahead. These two examples are just to clarify how the assumptions are different. In the first assumption, we said there is only one college, and all students from one college means there is only one true value. Here I am saying all these are 5 different colleges, all have different aptitude scores, but they follow a distribution. Let me find out the average of this distribution. I hope I am clear with this aspect. Dr. Priyanshu?
Yes, ma'am. Yes, ma'am. Thank you, ma'am.
And again, I will encourage you to go ahead and read this article. It's a very, very interesting article which will clarify your concepts. So again, what do you see here in these graphs? Can anyone comment, especially about the heterogeneity and the models?
In all the models, the 95% confidence interval are overlapping,
Yes.
and they used a common effect model, like a fixed effect model. Values are given.
Both models have been used if you look carefully.
Yes, ma'am. Sorry,
And you
thank you.
see when the heterogeneity is minimal, both the estimates and the 95% confidence are very similar to each other. And when the heterogeneity is more, right, then you will see that they
The
differ from
difference.
each other. The summary
Yes.
estimates and the 95% confidence are different from each other,
Yes, ma'am.
right?
Yes.
So when the heterogeneity is negligible, you can afford to just stick to the common effects model by assuming that there is a true effect, and we are attempting to find that true effect. If it's a random effects model, you acknowledge that there is a real difference between the effect estimates between the studies. Let us find out the average of these effect estimates. And usually you will see that the 95% confidence of the random effects model is wider than the fixed effect model, because you in the weights you are taking into account the weight, the within study plus the between study variance. right? Now, when you are writing in your method section, you need to mention the rationale why you selected a particular model. So if there is substantial heterogeneity, I told you using a fixed effect model is unrealistic, because the fixed effect model does not acknowledge the heterogeneity when it is calculating the confidence interval. It will calculate a narrow confidence interval, which will give you a wrong interpretation. And again, it will limit your generalizability. So in public health scenario, majority of the times you will end up using a random effects model. Now in each of these, remember that whether it's fixed effects or random effects, it's a two-stage process. When you're doing a meta-analysis, first step is to find out the effect size for each individual study. And then the second step is to combine all these individual effect sizes to get a pooled estimate, which is usually a weighted average. What weights you assign depends upon the type of model you are using. So usually the methods which are used for weighing,
Sample
yes,
size.
sorry, Ajit. Okay, so the method which is used for calculating the weights could be either the inverse variance method, or there are other methods like the mental Hensel method, which can be used for both the models, or the Pareto method, which is used only for the fixed effect model. But the most commonest one is the inverse variance method, which is safe to use. So this is showing the inverse variance method, where we said that the weight which is assigned is the inverse of the variance. It can be used for binary data as well as for continuous data, and for all measures of effect, be it the risk ratio, odds ratio, or the mean difference. So when you have studies which are large and when the events are frequent, it is safe to use this method. But if the data are sparse or the events, that is the outcome, is rare, then you may have to switch to MH or the Pareto method for the fixed effect model. So if you're not understanding anything, of course, it means we have to read a lot, because when you are trying to do the meta-analysis, you have to submit these options in any app which you are trying to use for the meta-analysis, and hence you need to have some knowledge about the models and the methods which you will choose. For the random effects model, I told you, you have to account for the within and between study variance, and the between study variance is measured using this, what is known as the tau square. So the way which you give to each study is the inverse of the variance of the within and the between study variance. And tau square, again, which is an output which is given in a forest plot, is nothing but an estimate of between study variance. More is the tau square, it means more is the heterogeneity. And this is also used for weighing the studies in the random effects model. This is something which you should remember. Now, this model choice has to be done very carefully, because it affects the computation of the pooled estimate. Also, it helps you to define the goals of the analysis, right? Because I've told you our assumptions are different. You have to interpret the statistic accordingly and generalize it accordingly. So your interpretation of the pooled estimate, the extent of generalizability also varies depending upon the model which you choose. So what are the two models we are talking about?
Fixed effect and random effect model.
So do you find there is any mistake here in this slide? There is actually one mistake. If you have noticed till now what has been done, what is the mistake? Now, can you find out what is the mistake? Was there? What mistake was there? So please look at this particular thing here. This is a random effect model, and this is a random effects model. So our assumption is clearly shown in the name of the model. We are saying there is a single true effect. Here we are saying that there are multiple true effects. So you always have to remember to say fixed effect model and random effects model. Are you with me here?
Yes, ma'am.
So now these are again two forest plots. What do you see here? Now these two forest plots, let me first tell you that are we looking at the odds ratio or the relative risk here? No, we are looking at standardized mean difference. This is not even mean difference, it is standardized mean difference. So usually when do we use standardized mean difference? Supposing we have an outcome which is measured on a continuous scale, but the units are different, or the scales or the tools are different. So the mean which you get and the mean differences which you get are going to be different in each study. So you bring it all together, make it unitless by calculating a standardized mean difference. And the null value for the standardized mean difference will be 0. So this is the null value, the central line in both of these cases, right? So because it is a difference, if it is a ratio, the null value is 1. If it is difference, the null value is 0. Now this forest plot on the left is, you can see here it is fixed effect. It should be effect model, and this is random effects model. Now both of these are giving the same result, right? Because you can see actually the studies are giving very different estimates. But purposefully, I am showing you this slide where the summary results are the same. But I want you all to interpret these results based on the model which has been used. So how would you interpret this pooled estimate and its 95% confidence interval? Because we are making different assumptions, right? Here we are saying that there is no heterogeneity. All of them are measuring a single true value, and that single true value is this value. And the values, the summary values of these different studies can vary from year to year. So in these studies which have been conducted, in fact, the standardized mean difference can vary from year to year. While here I am saying that all of these are measuring different things, and the average of all the summary values in different studies is this value. And the 95% confidence interval tells me the 95% interval, that is the lowest and the highest for these different summary values. Are you with me?
Yes, ma'am.
Yes, ma'am.
So here you have to imagine that there is only one true value I am getting. Here you have to imagine that there are many values, and this is the average of those values from different studies. Here there is no heterogeneity assumption, and here that they are different from each other, and hence I am using the random effects model. So you can see that when you are summarizing the result, it is not just one summary value, but the 95% confidence interval also which needs to be reported. And because this is lying on one side of the null, not crossing the null value, it is statistically significant. So significant reduction is seen because of the intervention in both of these models. Now, how do you calculate the next thing? When you're actually doing the meta-analysis, you have to decide there are different approaches to calculate this 95% confidence interval which I showed you. The commonest method is known as the Wald method. And there are situations, for example, if there are less number of studies or studies with very small sample size or rare events, then you have to use the HKSJ method for calculation of the confidence interval. So again, this is something which you need to choose which method you will use for confidence interval. If you have sufficient number of studies, all having sufficient sample size and common outcomes, you can use the walled method. Now, this is one study which is looking at the association between homocysteine and coronary artery disease. And this is a SRMA which has been done. So there are, you can see multiple studies which are there and you can see the outcomes. And I'm just showing you a part of this forest plot, the lower part, so that we can discuss. So here you can see that this tau square is also a output which comes up in a forest plot. And I told you this tau square measures the between study variance. So this is also telling you a part of the heterogeneity. So you can see all of this line is in front of this term heterogeneity, the tau square, the chi-square, which is the Q statistic, and your I square. So tau square is 0 or near 0 means there is no heterogeneity. And if it is anything away from 0, it means that there is significant heterogeneity. So you remember that tau square is also telling us something about heterogeneity. Another thing you can see is that these are individual studies. Then because this is mean difference, the null is 0. And you have this diamond shape, which is the summary value, which is 0.73. And you can see that there is this 95% confidence interval. And because there is heterogeneity, substantial heterogeneity, we can assume that they have used a random effects model. Now, when you look at this 95% confidence interval, do you see anything else which catches attention in this particular forest plot? So forest plot, you will have details of the study. You will have the summary statistics and the sample size for each study. You will have a mention of the weights which have been given with the model which has been used and the inverse variance method which has been used to pull the estimates, the 95% confidence interval for each study, and the plot here. But what other thing which we have not talked about catches your attention here? Apart from these numbers, the pooled estimate and the 95% confidence interval reflected in the diamond.
Ma'am, that red color line.
Yes. So this red color line here is the prediction interval, right? So whenever you do a random effects model, you need to report the prediction interval. The 95% confidence interval in the meta-analysis just tells you whether the average effect is significant or not in the studies which have been included in the meta-analysis. So in the meta-analysis, the overall pooled estimate is 0.73 and the average effect ranges from 0.53 to 0.91. This is what the 95% confidence interval means. How is the prediction interval different? Now this tau square is used in calculation of the prediction interval, and the prediction interval, how do you interpret the prediction interval? That in the future, if any similar study is done to answer a similar research question, the values of the which you will get in the study could vary anywhere from -60 to 2.05. So for policymakers and in real world, the prediction interval holds more value. So whenever random effects model is used in meta-analysis, you should not just restrict yourself to report 95% confidence interval, but talk about the prediction interval too, which are usually going to be very, very broad compared to a confidence interval. Are you with me here?
Yes, ma'am.
Yes, ma'am.
Because I'm going to tell you clearly the difference between the two in the upcoming slides. Exactly what is the difference between confidence interval and prediction interval once again. Just hold on. Because I'm going to first talk about this aspect. That is, when you are doing your meta-analysis, you also have to finalize what method you are going to use to calculate the between study variance. Now, the tau square I told you is an estimate of between the study variance. So what options do you have to estimate the between study variance? One is the DL method, which is very, very simple. But if there is high heterogeneity, avoid using the DL method. The most common or the most recommended now is the restricted maximum likelihood method wherever the studies have high heterogeneity. But if there are few studies, then the SJ method, the Siddick-Jonkman method, is the recommended method. So you have to now also decide how to calculate between study variance. One of these methods you have to choose depending upon the heterogeneity and the number of studies which you are including in your meta-analysis. So again, here in this particular meta-analysis, you can see that tau square is calculated, and then you're using the tau square to calculate your prediction interval, which now has the null value of 0. And this prediction interval will be utilized by policymakers because they will have to decide if this is done now in the future, whether it is going to be effective or not. So the confidence interval, actually the 95% confidence interval, tells you where does the true mean effect lie, the estimate of the average effect. So it does not fully, capture the between study variability, and it focuses only on precision. How precise is your pooled estimate? To talk about what would happen if a similar study is done in the future, you have to report a prediction interval. And when can you calculate prediction interval? One scenario is that you are doing a random effects model. Another is that you should have sufficient number of studies, 5 or more than 5 studies in your meta-analysis, and you do a funnel plot, and you have to be sure that there is no asymmetry. So what does a funnel plot tell us, if anybody knows?
Publication bias.
Yes, publication bias. So there is no funnel plot asymmetry means there is no publication bias. So there should be no publication bias, sufficient number of studies and random effects model. Then go ahead and report a prediction interval. So these two are different things, and they have to be interpreted and reported in your results and discussed in your discussion section. The prediction interval will be wider. It will cross the null, but it will be of value for policymakers. So now here, what do you see? This is a random effects meta-analysis of 12 trials to examine the effect of inpatient rehabilitation designed for geriatric patients versus usual care. So there is a special rehabilitation care program versus the usual care program, and you are looking at functional outcome. So this appears to be a binary data for the study, functional outcome, satisfactory, yes, no, and they have 12 studies. So can anyone go ahead and attempt to interpret all the numbers which are there in this forest plot? How would you describe, if you are given a question, describe this forest plot, how would you describe the forest plot?
Ma'am, there are 12 studies,
Yes,
the plot, and they have the weightage is given,
yes.
and the odds ratio along with 95% confidence interval is given.
Correct.
Um,
You are right. And the weights are, if they are very similar to each other, then you can safely say that this is a random effects model. If you look at the p-value, which is for the chi-square and the I-square, again, it gives a hint that this could be a random effects model. Then how do you comment on the summary estimates and the heterogeneity? First, the heterogeneity I have already commented on. What about the pooled estimates? If it's the odds ratio, you know what is the intervention and the comparator and the outcome. So you can safely interpret that the odds of satisfactory or improved functional outcome is 1.36
1.36
times
times.
in those who got the inpatient rehab care versus the usual care.
Yes.
And in these studies, the summary estimate can vary between 1.08 to 1.71. And how would you describe the prediction interval that if a similar study is done in future, then the odds of improved functional outcome could vary, where it could be 30% less in the intervention group compared to the usual care, or it could be 2.64 times more. So you can see the null value is included in the prediction interval, right? So the prediction interval says that the geriatric population receiving the inpatient rehab can be worse off than usual care. There is a chance that that can happen if you repeat the study, or they could be benefited. Both things can happen. So your prediction interval interpretation is for future such studies which are done, and your 95% confidence interval is about the studies which are there and the summary values which are there for the studies included in the meta-analysis. You need to read up and understand these concepts because their interpretations are different from each other. This is another study now. Here, again, it's not the odds ratio, it is standard mean difference. Here you can see that, again, there is heterogeneity present. Random effects model probably has been used. And you can see that the 95% confidence interval is on one side of the null, so is the prediction interval too. So even if the study is done in future, this is looking at the effect of antidepressants pain in patients with fibromyalgia. So it is going to be protective even when you do such a similar study in the future. It shows that it is going to be beneficial to the patients. Are you getting me here?
Yes, ma'am.
So before I really go into this meta-analysis, how it is to be done and the different components, I just want to be sure if you have any questions, you can ask me before we move ahead.
Ma'am,
Yes,
ma'am, you told based on the outcome we decide the effect measure.
yes.
So ma'am, we can also decide based on the study design.
Outcome, what I'm trying to say is if it is, for example, binary outcome, right? So you will not calculate difference. If it's a continuous outcome, you will prefer mean difference, mean standard deviation. If it's a binary outcome, you will go in for odds ratio. If it's a follow-up cohort, is there a risk ratio? That is what I'm trying to say. That is the estimates which you are playing around with. For example, here I am looking at pain, and probably pain is measured using some scores, and they have calculated mean scores in individuals who get the intervention, who do not get the intervention. Now here I cannot calculate odds ratio, right, or risk ratio. I will have to look at the mean and the difference in the mean. That is what I'm trying to say. Here in the previous study, I am looking at a binary outcome, whether there is improved function, yes, no. So I am looking at an odds ratio. So this is a relative measure of association, while here it is an absolute measure which I am looking at. This is what I am trying to say when I say the outcome measures help us to is to be decided when you look at meta-analysis. Are you getting me?
Yes, ma'am. Yes.
Yeah. So that is what I want to talk next about. That is when you are doing a proper now meta-analysis, these are some decisions which you need to take. One is, what is your effect estimate? Is it odds ratio? Is it relative risk? Is it mean difference? The next assumption is, what is the model you want to choose? So what are your assumptions? Are they fitting the fixed effect assumptions or the random effects assumption? This will be driven by the heterogeneity between the studies. Then you have to decide what is the method I am going to use to actually get the pooled estimate. That is, what are the the weighing measures I'm going to use. This is going to be inverse variance, Mantel-Haenszel method, Pareto method, which is only for fixed effect. Then I have to say which approach I'm going to use for the 95% confidence interval. That is to estimate within study variance. There are two options. The Wald method, where you assume normal distribution. But if you have small sample size, rare events, high heterogeneity, you may have to go with the HK method. Then you have to decide what method you are going to use for between study variance. That is your tau square. Here you have certain options like the DL method. But if there is high heterogeneity, you go in for the REML. But if there are rare events, small sample size, then you have Siddick, Jonkman, or the Paul Mendel option. So these things, no, you have to specify when you actually do your meta-analysis. So you should know which method to use when. This is just a flow diagram to help you understand that fix up the outcome, be clear. That means that for every study, you should be able to calculate this outcome. That is what you have to be sure about. Then check your heterogeneity, then decide the model, then choose the method for pooling the estimate, choose the method for confidence interval and tau square, and then report all of this. The safest is to go in for inverse variance random effects model in public health scenario with REML method for tau square and HK method for confidence interval. There are multiple softwares you can use, but there are some online softwares. And if you are ready to do hands-on, I can just share. We have shared some Excel sheet with you already, and we can just go ahead and demonstrate how to do meta-analysis in meta-analysis online. So what do you all say? If you all are
Yes, ma'am.
tired, then we can wait. Even if one says yes, I will go ahead.
Yes, ma'am.
Yes, ma'am.
So if you all want, you can use this, open this meta-analysis online. So this is meta-analysis online. Simple meta-analysis you can do using this software. The only thing is you have to mention the references in your study at the end of the study and in your methodology that you have used this for the investigators or the researchers who have developed this. This is the data which I have shared with you. So if anyone is opening it, do tell me, because I will also try and open and share it with you so that I can actually show how things are done. Is anyone opening?
Yes, ma'am. There are options like select available data.
Correct. So I will tell you what to do. If you can understand, of course, you can go ahead and try and play with the options which are there. Because I'm opening. Then I will share my screen so I can show things to you. Are you all able to see my screen?
Yes, ma'am.
Yes, ma'am.
Yeah. So, and you have this data with you. I suppose this data with you.
Yes, ma'am.
Okay. So now see, this on the left hand side, you can see that you have to select the available data. Now, if you have different studies and they are reporting these estimates and you want to use their estimates and 95% confidence interval, that is one option. If you have total and the events number for the different interventions, say control group, that is one option you can choose. If it is continuous data, if there are two groups and each one you can have mean and standard deviation, you have that option. If it is one group and you want to just report the summary, mean, then that is one group. If you are doing prevalence studies, then that is one group. If you're doing pooled incidence studies, then that is one option. So this is actually depending upon your research question and what is being reported in different studies, you have to make a choice there. One of these pooling is done in one of these methods. Then if you move down, there is switch to network mode, means it is for network analysis. We are not looking at that here. Then you have this add subgroups. Now this you will do only if you want to do subgroup analysis. So I'm not going there. You want to have generate a forest plot or a funnel plot or a table. Now we are interested in forest plot. So I'm just sticking to forest plot because we are talking about meta-analysis. Till here you all are clear?
Yes, ma'am.
Yes, ma'am.
Yes. Now, if you move down, if you click on advanced settings, then you will see model. There are two options, random effects model or fixed effect model. That you have to decide. Then something known as method. Now this method is for weighing, for pooling the data. Now option is inverse variance. I told you this is the safest method, safest bet. So be it fixed or random. So this particular software gives only option of inverse variance, which is good enough. Then it asks us, how do you calculate between study heterogeneity? What will be the estimator? So these are the options which we discussed. So if you have large number of studies and outcome or the events are common, you can go in for DL. But I told you the safest bet is restricted maximum likelihood. If it's rare, small sample size, then you go in for these two. The last one is the best option. And then I told you for confidence intervals, if you feel that you have less number of studies, high heterogeneity or less number of studies, rare events, then you choose this option for 95% confidence interval. Otherwise, what is the option I told you for 95% confidence interval? If anyone remembers. The walled method. That is the default method. You have to specify if you want to change it to the KH method. Are you with me till here?
Yes, ma'am.
Yes, ma'am.
So the next thing you do actually now for using the data which I have shared, all you have to do is first look at the number of studies. So there are 14 number of studies, right? So you just keep on adding the studies. So you add 14 studies here. This is the third study, fourth study, fifth, sixth, seventh. I hope you all are doing with me. At least some of you all.
Yes.
Because you will get your eureka moment only if you are doing with me. Otherwise, you will just keep looking. So my 10th study, how many have done 14? Anybody has finished doing 14? Ashwini, are you doing it?
Yes, ma'am. थोड़ा slow load हो रहा है ma'am network की.
Doing, madam.
Yes, yes. You can continue even after this session because I know
Yes, madam.
we have moved ahead of the time we decided. So I'll show it, but you can do it. Continue doing even after the session. So once I load the 14th study, I'll move ahead. So I have these 14. rows which I have added, right? Now here, I made a mistake. So you just be with me. I have made a mistake. I had remembered I had to do this. Anyways, you just stop doing whatever you just see now. See what my data is actually, if you look at my data, I should have told you earlier. So for using this software, you have to have the author year. Now what I have done, I have looked at the experiment sample size, the events in the intervention group, the control sample size, and the events in the control group. So I am sorry that I have to redo this, but you just have a look at it, because now I have to first select the data which is there. My data is total and events number. So what I will request you to do is just add, if you are with me, you can just add 3 rows and we move ahead with 3 rows. We won't do 14, we just load the first 5 studies and we move ahead with total and events. You understood the mistake which I did?
Yes, ma'am.
So because the studies which I am looking at, the data I have extracted is this. I have the author, I have the publication year, I have the sample size for the intervention group, the number with the outcome in the intervention group, the total sample size for the control group, and the numbers in the control group who have the outcome. So I have to choose this option for the data, that is total and events number. Now I go and I select this data for 5 studies. And what I have to do is, you are able to see what I'm doing?
Yes, ma'am.
I paste it here. So the data comes in the software. And all I have to do is say refresh. And you can see that I get my forest plot here. The forest plot as well as the conclusions are, the description of the forest plot is given below. So can anyone read this forest plot? What are you seeing? So what do you do first is look at the heterogeneity. The tau square is away from 0. The chi-square is very, very significant. The I-square is saying very high heterogeneity. And rightly, I have used the random effects model. There are 5 studies which are described. The events and the total are given. The grand total is given. The weights are being mentioned. And the summary risk ratio is also mentioned with the 95% confidence interval. Because I am using a random effects model, I have to also report the prediction interval. So you can see that while the 95% confidence interval, which is the pooled estimate, which is depicted by the diamond shape, does not cross the null value, the 95% confidence interval does cross the null value. So you can use this in your results, this forest plot. Do you have any questions here?
No, ma'am.
If I would have had small sample size, less number of events, I would have used some other estimator, or I would have used this other method of calculating 95% confidence interval. You can also see there is a mention of this continuity correction. So if the outcome is 0 in any of these studies, then I will use continuity correction. Means you are adding 0.5 to each cell which is there, so that you do not get any absurd value. That is known as continuity correction. So you can use the data which I have shared, and you can come up with your forest plot. Anyone has been able to do this much?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yeah. So do you have, I'll just stop the recording and then we can have a short discussion.